So not that we've heard of yet, but it's still very early. We haven't heard any word on whether or not things are going to keep moving forward with the new administration or not. From our standpoint in our presentation, our primary focus is how does legislation impact patient care, and site-neutral payments are certainly beneficial for payers. If we look beyond Medicare, that of course would impact your commercial payers. They're paying much more on infusions that are received in hospital outpatient settings. However, I think that when you go site neutral and payments are equivalent across all sites of care, you can lose sight of the patient care aspect and the benefits, as I highlighted in my part of the presentation. When you shift a member to home infusion, payers do that obviously at this point to save money. For cost savings purposes, you may lose some ambition to do so and run into things like I had addressed during my component of the presentation, where patients are more adherent to their therapy when you lessen those barriers to access and you make it more convenient for them to have a nurse, for example, come to their home and perform the infusion, versus them not even being aware that that exists due to site-neutral payment, where they're still going to the hospital outpatient facility, which costs them time, missed hours of work, etc. So not that we're aware of. Now, that wasn't something that we heavily researched for our talk. We were more interested and focused on patient clinical aspect for prohibitive legislation for site of service programs, as well as white bagging and brown bagging legislation. Having said that, I know that there was a bill that was perhaps not yet enacted, but in the state of New York, they were looking at site neutral payment legislation, but nothing enacted that I'm aware of.